on the on the MCLD's website after the event. The good news about this event is that we have got simultaneous interpretation going on right now in French and Spanish. So please, if you would like to tune into these languages, 2 languages, just go down under your screen. There's an select interpretation channel of your choice there. You go, there is something that looks like a globe, like the word, a globe. You click on that one, and then it will give you the options, and then you click the language that you would like to go to. Then it will take you straight into that translation. For sure, you know, we value everybody's voice. And at the same time, we want to make sure that we keep the noise out of the voice. And so please make use of the chat function. That should be your best friend. And I can see lots of people already typing in there. So please, let's make use of that to introduce yourself, share questions and comments and feedback as we go through the event. You can also raise your hand. You can use that raise hand feature when we come to the point of Q&A. And at that particular time, we'll be able to recognize you and give you an opportunity to speak. We will have breakout groups available also in French and in Spanish. And if you would like your language, like to join a breakout session in Spanish or French, this is the time now to make that choice. What I would like you to do is go to your name and then rename yourself by putting either FR or ES at the front of your name. All right, and this is what you do. You select participants, and then you click on your name, and then you click rename, and then in front there you add FR if you want to go to be assigned a French group for breakout sessions, or you type ES if you want to be assigned to the Spanish group. For those that are going to the English groups, you don't need to do anything as of now. Yeah, so that's it about logistics. Now, why are we here today? I think that's really the main question that we need to deal with as we move on. Colleagues, ladies and gentlemen, we know that the Institute for Health Metrics and Evaluation estimates that extreme global poverty has increased by 7% as a result of the pandemic. We also know that in addition to creating an unparalleled global health crisis, the COVID-19 pandemic has compounded the food security and the nutrition crisis globally. And yet, we also know that a community in Mcld district in Malawi, which is now 5 years after being graduated self-reliant from a CLD program, was recently subjected to an ex-post evaluation study, which has shown that households adopting and using improved farming technologies rose up to 99% during the pandemic period. Poverty did not increase, but remained constant in the same period of the pandemic. And hunger increased only by 3%. Outstandingly, child marriage actually decreased by 65% during the same pandemic. Last week, I was lucky to visit a community on 18th of November. I was lucky to visit a community in Palombe district in southern Malawi, which is implementing a nutrition sensitive program. And I was amazed to see that literally when I went into that community, and I mean it, literally every household had a pit latrine toilet with locally designed hand washing facility, literally every household. They actually challenged me when I entered the household. They said, you know what, we are not here to select a household for you. You can wander about through in our village and pick any household, chat with them, discuss with them, and tell us what you see. And they did not only have a toilet, each household, and a locally designed water hand washing facility. Each household had a protected rubbish pit. It had a home garden with vegetables and fruits in the home garden, a kitchen with a locally made cooking stove, drying lines, and a place where they dry their kitchen utensils after they have washed them, a very clean homestead, and mothers practicing exclusive breastfeeding. I saw functional care groups and many more. And they told me in their own words that we are making malnutrition history in our village. This is a community just visited last week on Thursday. What an undisputable result of the power of community leadership. This is why today, at this official side event of the Nutrition for Growth Summit, we will be focusing on community ownership as a key to good nutrition. In December 2020, the Nutrition for Growth Year of Action was launched. And in a few days from now, on December 7th up to 8th of 2021, the government of Japan will be hosting the Nutrition for Growth Summit in Tokyo. We believe that it is important for world leaders to see and recognize the importance of community leadership in attaining SDG 2 on zero hunger. And so welcome to our side event today. Now, why is community ownership key to nutrition? I have just shared my own experience of what I experienced last week and what I've seen in Malawi. And I'm sure many of you here would have seen similar examples, numerous of them from your own communities or communities that you have interacted with. But let me provide a few points to set the global context about our conversation today. Next slide, John. In Sustainable Development Goal 2.2, the world committed in 2015 to eliminate all forms of malnutrition by 2030. Next. Area that is in 2012, at the World Health Assembly, the world committed to 6 specific targets by 2025 for reductions in stunting, wasting, anemia, low birth weight, breastfeeding, and halting the increasing trend in obesity. Next. But the question is, so how do we do this? How do we achieve these 6 specific targets that were set in 2012 at the World Health Assembly? The best science on how to improve nutrition appears in the Lancet and calls on all of us to really focus on mothers and their children, to put our special focus on these 2 specific groups. Next, John. And the Lancet, they break down the complex set of necessary actions there into this set of 10 specific actions. And as you can see here, these 10 specific actions are ranging from health of adolescent girls through all the way to emergency nutrition interventions. Next. They also break it into 9 nutrition sensitive actions. And these nutrition sensitive actions are including access to health, clean water, and women's empowerment. Now, all these issues require grassroots people to learn more about nutrition and often overcome traditions and behaviors that harm the nutrition of women and girls. We are now just 4 years, ladies and gentlemen, to 2025. And yet today, no country, and allow me to repeat here, no country is on track to achieve the World Health Assembly targets. So this gathering becomes all the more important today. Next, John. And so now that we know the global context and the importance of our gathering today, what are we going to be doing in our conversation today? I would like to provide a picture of our agenda. And here, the slide that I've shown now is a quick look of our agenda. We have just covered in what I've said up to now, an introductory session of the structure and the purpose of today's session. And I will end up this session with a short introduction to MCLD. This will be followed by a short presentation from some powerful speakers that we have lined up during this session, illustrating how communities are strengthening nutrition through multi-sectoral interventions. We will have a brief Q&A after that, and then we will go into breakout groups to talk about specific pathways or strategies for community action on nutrition, the barriers, and better coordination between the government and civil society, because that is very, very key. And then lastly, we will come back together again from our breakout groups to share some key takeaways and explore our next steps. Now I'll turn to the introduction to MCLD as I transition to the most exciting part of our conversation, which will be the panel of our speakers. So before I go there, please allow me to give a brief introduction to MCLD. Next slide, John. The Movement for Community-Led Development, which we call MCLD, was launched in 2015 on the same day that the SDGs were announced by the UN General Assembly. At that time, a group of organizations got together and said that if we are truly serious about the SDGs, then we have to put the communities front and center in development. That was the driving force for the creation of the Movement for Community-Led Development. Next, John. Next. And today, as we stand here, our global, if you go back one slide, John. Thank you. Today, we are a global consortium of over 1,500 local civil society organizations and 75 international NGOs that believe in the power, the promise, and the possibility of every community. And through strategic and collective action, MCLD seeks to ensure that every person has a voice in decisions that affect their lives. Secondly, to connect individuals with equal and affordable access to public service. And thirdly, to build a partnership between local civil societies and governments. And so the Hunger Project serves as a global secretariat for the movement, but really the heart and soul of the movement are our national chapters, which are organic groups of local NGOs and country offices of INGOs that come together to address a common agenda. We currently have 17 national chapters across Africa, Europe, and Latin America. Next. And before I go into the goals of our MCLD, I would like to speak briefly about what is community-led development. Community-led development is a planning and development tool that involves the process of collaborative work to achieve and create locally owned visions and goals. So this approach is based on a set of core principles that seek to encourage the leadership of local voices, build on local strengths rather than focusing on problems, and set visions and priorities according to the people who live in that particular geographic community. And so at the movement, we have identified 5 goals for ourselves. And those are the goals that are being beamed right now on your screen, which is voice and agency for women, youth, and marginalized groups, adequate community financing, good local governance, quality public services, and resilience. Next, John. I know this looks complex, but really it's not a complicated diagram. This is all about our theory of change, and it talks of 2 main things. It talks of 2 main things here. The 2 main things are, there are like the pathway, the formation of 2 types of partnerships. you will see on top there, advocacy partnerships, and at the bottom here, facilitation partnerships. So through advocacy partnerships, civil society can engage national governments to decentralize and devolve public resources to the community level. And down here at the facilitation partnerships, what we say there is citizens achieve healthy, productive, resilient, and self-reliant communities. When these two streams converge, they develop capacity and commitment to the goals of community-led development. And so community-led development programs are really facilitated by the work of the movement national chapters in the countries where we work that bring together civil society and aligned actors to support this theory of change and work working with the global working groups that support these in-country processes by networking, coaching, research, and evidence building and supporting communications. Next, John. And so at this point, ladies and gentlemen, now is the moment we have been waiting for. And that's why we came to this call. You know, this is the point where we transition to the most exciting part of our conversation. And now I would like to hand over to your moderator for today, my colleague Gunjan Veda. Gunjan is the Senior Advisor in Global Collaborative Research and Public Policy with Mcld. She brings many years of experience working on issues of nutrition and food security as a grassroots activist, a development sector professional, and a policymaker with the Indian Government Planning Commission. Ladies and gentlemen, Gunjan Veda. Over to you, Gunjan. Thank you.
Thank you so much, Roland. Thank you for that beautiful, introduction and for really setting the scene for this dialogue. And now, without further ado, I'm actually going to introduce our speakers for the day because I want to make sure we have time to engage with our speakers and to, ask questions of them. Before I do that, however, I'm going to make a quick request. After the panel discussion, we will be going into breakout groups. In our attempt to ensure that we are accessible, we have introduced Spanish and French interpretation as well as breakout groups. However, we need your help to do that. So please put ES in front of your names if you want to be in the Spanish breakout group after the panel discussion, and FR in front of your name for French. Thank you so much. My colleague Anna is working behind the scenes very hard to make sure that everybody has access to the group they want to be in. So we want to make sure that, we know how to do that. So I'm going to introduce our first panelist for today, and that's Grace Chikovi. Grace is the country manager for the Hunger Project in Malawi and brings extensive experience in the areas of HIV, nutrition, and gender. So Grace, over to you. Tell us how communities are changing the nutrition story in Malawi.
Thank you so much, Veda, and everyone who is listening on this call. I would like to share our experience in Malawi to say that we've seen a lot of impact and a lot of progress, especially because we are involving the communities and that the communities are taking ownership. So what makes our approach special is the fact that we still use the mindset change approach where we emphasize that communities take ownership and are able to identify the situation, to identify the problems. And as they are identifying problems, they know that nutrition is one of the things that malnutrition is one of the things that they need to address. And when they identify malnutrition as something that needs their attention, then they come up with strategies on how do they want to address that problem which they are facing as a community. So in Malawi, that is one of the things that we are working on. And one of the best things that we have done is that in the past, we used to work in isolation. So each institution would go to the same community, trying to address malnutrition problems and emphasizing on a specific message in isolation. Now, as Malawi, we're trying to make sure that there is coordination of all partners, all players working on nutrition interventions. So come together, plan together at district level, and we go together to the community with one same nutrition message. And when we get to the community, we emphasize on ensuring that the community are in the forefront of implementing the strategies that are aiming at addressing malnutrition. So the community is then mobilized in such a way that we all bringing the same message, we all empowering them with the same education, and then they are empowered to address the gaps and the issues that they are facing with malnutrition. The other part in which we are ensuring that we are all speaking the same thing is that we're also ensuring accountability. So we make sure that there is flow of information from the community to the district to the national office, such that in the community, people are able to keep records of how many supplements do they still have. If they have run out of their supplements in the community, for example, we use micronutrient powders, they're able to demand for the micronutrient powders from the district office and also from the national office. So we have empowered the community to voice out. Besides empowering the community to voice out on the nutritional needs, these communities are able to take responsibility. For example, Lawrence just mentioned of what he witnessed in these communities. These people do not only just look at the need and then wait for the miracles to happen. So in order for them to address malnutrition, for example, they need to embrace dietary diversification. And dietary diversification cannot just come without doing something about it. They need to have they need to have crop diversification in their field. So they are empowered to do crop diversification, to grow crops that are bringing them different nutritional requirements when they are prepared into food. And besides that, we cannot just be mentioning of dietary diversification if we're not talking about food security. So we also have interventions that are addressing food security at large. So in terms of dietary diversification, these households have backyard gardens in which they grow different kinds of crops. They have fruits in there, they have vegetables in there, they have staples in there. But besides that, we also look at the long-term issues. So when the rains are happening, so they grow during the rainy season, they also grow off rainy season. And then during the rainy season, which is the main growing season, they have also to consider what kinds of crops are we growing. So for example, they have to make a deliberate choice to grow orange fresh sweet potatoes just because they're rich in vitamin A, and they want to address that nutritional need. And besides that, they have to determine which crops are more resilient to droughts. They have to determine which crops would bring them more yield for them to keep having food in their household throughout the year. So what I'm trying to say here is that we have an integrated approach where we are addressing the needs of the household from the farm to where they are cooking. And even when it comes to preparation of those food, we have cooking demonstrations. You know, it's one thing to have enough food in the household, and when we don't know how to prepare those food, you end up burning out all the nutrients in the food. So we have a way of also training the community to prepare those meals in a way that they retain the nutritional value. Besides that, it is one thing to have all these things happening in the community, and actually all the community interventions are aiming at preventing malnutrition. And indeed, with these interventions, we have seen reduced numbers of children being admitted in nutrition rehabilitation units because we are preventing malnutrition at household level. But besides that, we understand that we're all promoting scaling up nutrition, which is nutrition in the first 1,000 days. And this nutrition in the first 1,000 days is targeting pregnant women. At the point when a woman falls pregnant, they are immediately recruited to join what Lawrence referred to as care groups. In these care groups, they have those discussions taking place on how they can take care of their pregnancy, on how many antenatal care sessions do they need to attend, and get that special message, like a personalized message from the health workers, and how they are supposed to utilize the messages which they're getting from the health facilities. Besides that, these women are also empowered with skills to make sure that they are empowered to make decisions on when to seek healthy services and what to expect when they go to seek those healthy services. So they have all this full package, and we have that coordination where we all report those people who are working in agriculture sector, those people who are working in the healthy sector, those people who are working in the social welfare department. We're all coming together in a what we call nutrition coordination committee, where all these are brainstorming and coming up with strategies and issues to address to make sure that these communities are empowered and are able to prevent malnutrition. So 3 things if you're to get out of here: integrated approach, coordination, monitoring and evaluation to ensure accountability and empowerment of the community. That is what I have to say for now. Thank you.
Thank you so much, Grace. That was such a powerful example. You know, Roland started out with talking about the nutrition specific and the nutrition sensitive interventions, right? And the approach for nutrition. And I think you have beautifully encapsulated how the two can really come together for real results. You know, that integration of that in Malawi. Thank you so much for sharing that. If you have questions for Grace, if you have comments, feedback, please use the chat box to put them in. We will have time for Q&A, and we will come back to the chat box for questions. So please use the chat box. But now I am going to move on to our next panelist for today. And we're going to shift continents and move to Nicaragua. So Lisdania Velasquez has been training community-led development, has been facilitating community-led development as part of Alcance Nicaragua team for 16 years. In addition to being a community facilitator, she is also a field monitor and trainer working closely with other members of the Alcance team on field-related matters. And Lisdania, yours, I know, is a beautiful story of how a community came together and decided to tackle, you know, malnutrition and, you know, how it did that. So please tell us about it.
Thank you. Good morning, everyone. In our original description of this event, it had mentioned that about food environment, which means people nutrition and health, it depends on a whole system. Today, I want to share what such a system looks like in a community our organization supports. Most important to note is that this system is a result of local women actions to address their community needs. And I want to feature a long project started in one of the community our organization support. And the name of this community is El Llanito. The Agriculture Loan Project was a project that was born as a consequence of problems faced by farmers due to high prices of agriculture input and lack of financing for farming in 2015. Such a high prices mean that families could not produce as much as food as they need, but also that the quality of such a food was severely affected. Because they struggle to produce their own food, households have no option but to buy cheap alternatives, which are mostly low in nutritional value. The fact that the local farmer couldn't produce their own food, the nutritional health of their community was at stake. The leader of a group called Manos Unidas has its organized group established in 2008 and formed by 25 members from El Llanito. Identified different alternatives that could solve the food production and nutritional concerns. The Manos Unidas group has its own fund of contribution from the member, from each member, and they were able to achieve $1,050. The leader will, with the approval of all the members of the Manos Unidas group, use these funds to give community loans. This was a pilot experience of providing loans to nine members of the group that allowed them to buy agricultural inputs and land rent for their beans and corn crops. But so what are some accomplishments that this new system created in El Llanito have achieved in 2015? The first farmer loan experience in 2015 was successful. The members paid back their loans. Additional, they agreed to pay interest, 1% interest per month, and also they wants to give $2 for stationary expenses. In the following season, loan application increased by 60%. The group did not have enough funds to provide funding for all the applications, but they identified organizations to whom they submit proposals that will give them funds to finance farmers in their community. By 2017, the group was giving loans to 60 farmers in the community of El Llanito. The group diversifies the loans to respond to other nutritional concerns in their community. For example, in 2020, they created a fund with $5,000 for food package loans for time of crisis, like for example, COVID-19 last year. And also we have two hurricanes that affect our country. So they use this fund to give food package loans to families. This fund made it possible to benefit 100 families last year. And this year they also were giving food package for families that was needing. The community leader of our Grupo Manos Unidas today have a total of funds available of $11,000. And what has been the impact of this project? The agriculture loan project was gave participating group members an opportunity to store basic food, beans, corn, sorghum for summertime. A percentage of the harvest is sold to supplement their diet to be more diverse, rice, oil, soybeans, other kind of food. The store corn or sorghum is additional quality feed for the poultry animals, chicken, pigs, which is important part of their variety of their diet. Before the project, farmers were borrowing from local loan sharks to finance their crops. Local loan sharks shares from 5 to 10% per month. Borrowing from their own group means no longer paying such a ridiculous charges. Moreover, the interest that they now pay on their loan enable more community members to participate in the project. Families are consuming a variety of food because of this. This is sustainable project because each participant member feel that they are the owner of this project. The group has begun to support two more rural communities with loans for push-up agriculture, import, and rent land. So they now are supporting others' community, not just their community. Manos Unidas Group has provided in 2015 365 loans to farmers. 40% of all households in El Llanito have benefited from this project. We have allowed them to be healthy because they have access to food in summertime and also diverse food sources. And now we will hear from Adelaida Suarez, the treasurer of this group, her reflection being part of this experience. So let's hear her. We have a video to share with you.
Thank you so much, Nazania. And I know John's going to be sharing the video with us. And thank you for getting the voice directly from the community to us today.
Soy Adelaida Suárez, líder del grupo Manos Unidas de la comunidad del Llanito en Nicaragua. Y desde el 2015, otros 6 líderes y yo hemos estado manejando el proyecto de préstamo agrícolas. Como líder comunitario, siento que el éxito de este proyecto es que es nuestro. Nació de nosotros mismos. Fuimos los que empezamos con un fondo propio los préstamos a los agricultores. Creo que el éxito de la sostenibilidad de este proyecto de préstamo agrícola es que cada miembro tuvo que dar una inversión personal y así pudimos tener propiedad colectiva. He aprendido a través de estos años manejando este proyecto que tener propiedad colectiva es un proyecto que permite una transformación en las mentes de todos nosotros. Todos somos dueños, todos estamos tratando de tener una comunidad saludable con acceso a comida y a una dieta balanceada. Todos estos años nos hemos enfrentado con desafíos, pero lo importante ante los desafíos es la unidad como grupo y juntos resolver y dar solución a los problemas con los que nos enfrentamos cada día.
Thank you, John, and thank you, Losdania, for helping us hear directly from Nicaragua, from the community, what difference, community ownership and leadership can make. And now we are going to move back to Benin, to Africa, to Benin, and we are going to have two professors with us from the School of Nutrition, Food Sciences and Technology at the University of Abomey Calavi in Benin. We have Professor Pierre Coyote, whose expertise is in food quality and food product development with special attention to micronutrients. And then we have Professor Nadia Fogny, who is the Associate Professor at the school and is also head of the Strategy Center at the Institute of Food Security. She has published extensively on food ethnography, food systems, and nutrition assessment. Both of them were involved in Project 40 Moringa in Benin, and will tell us a little more about that and what happened there. I think we're going to start with Professor Coyote. Professor Coyote, over to you.
Thank you very much. I would like to tell you about our experience in the 40 Moringa project that have been implemented in Benin for 3 years. The project aimed to valorize the Moringa leaves for a better nutrition of vulnerable group in Benin. So we had various work packages in this project. The first work package deal with the improvement of the productivity of the leaves on the farm. And secondly, we focus on the improvement of the processing chain of the leaves. And thirdly, we develop infant food for vulnerable children in Benin in order to improve their nutrition. And we also evaluate the impact of this improvement on the health of the children. So what we achieve, firstly, we develop the agronomy practice in order to improve the leaf yields. So we realized that when we apply various improvements in terms of fertilization, we can achieve as high as 35,000 kilograms of leaf per hectare. When minerals fertilizer is applied, about 50 kilograms per hectare. And also with a plant density, which also affect the yield. So the plant density should be not more than 0.2 meter times 0.2 meters. So what we do next is the processing. So we standardize the Moringa leaf powder processing chain and establish the optimum drying condition for the leaf. So the message there is that when you want to dry the leaf for the market, you should apply temperature not higher than 53 degrees. And then you can dry the leaf for 44 hours. Then you will be able to get leaf powder of good quality for the market. Because nowadays in Benin, many people, because of this campaign that have been done by the Hunger Project in Benin, there are a lot of people processing Moringa for the market. And the problem is that the quality of the products on the market is not very good. So that's why we focus on this. And now we achieve quantitative data that can help processors to better process the leaf for the market. And after this, we try to produce the design an infant food that incorporates moringa leaf, because the moringa leaf is very rich in nutrients. And the question is how and in what level we can incorporate it in the infant food. Because the problem with moringa leaf is the color. When you include it in the foods, it gets green, and then consumer may reject the product. So we try the incorporation in various percentage in the food, and realize that when you incorporate the leaf in a proportion of 10% in infant foods, it can be accepted by the consumers. So, and we did this work in agreement with the Codex Alimentarius, which is the standard for infant food in the area. So the product that we design, we develop, is in agreement with this standard in terms of protein content, which was about 23%, even higher than the 16% required for this kind of infant. So, and also in terms of fat content. We also develop approach for quantitative production of the flour at the pilot scale and at the university. So we were able to produce a total of 2 tons of the moringa fortified flour. And we also produce for the dissemination about 300 kilo of the leaf, moringa leaf powder, dry, for the feed box. The infant flour were able to register and certify it at the National Agency of Food Safety according to national regulation. So the next work that have been done is to try the effectiveness of the infant flour on the daily growth of the children. Professor Nadia will tell you about this aspect. So thank you very much for your attention.
Thank you, Professor Coyote. And Professor Nadia, over to you.
Okay, thank you. Can you see me? I'm turning on the video for a few minutes. So, well, to continue on the talk of Polycarpus or Polycarp Coyote, with the 2 developed products of from moringa leaves, we have tried some bioefficacy studies. So one study on the effect of moringa leaves, flowers, complementary porridge on weight growth of moderately acute malnourished children in Benin. So we have 2 groups, a group of 75 children aged 12 and to 59 months that were moderately acute malnourished. And we have the same number of healthy children as control group, and they consumed the improved flour porridge for 5 days during the week, during 6 months. So their weight were taken before and after the intervention. And for the women, it was the moringa leaves powder that they used. So they put it on any kind of food they want to eat for 3 months. During so the consumption frequency was approximately 70 grams of moringa leaves powder for 5 days during 5 days per week during 4 months. So we also perform sensory tests and to follow up the anemia. This one was with 2 groups of women, one intervention group that are mild and moderately anemic, and a group of healthy women as control. So in brief, we have had a result that 98% of the mothers of the children, they love very much the complementary porridge of the children. And from also the sensory test, we have 75% of mothers that like the moringa leaves flower porridge. And we got a significant increase of the weight gain of the children of 1.8 kg per children after 6 months of daily consumption. And for the moringa leaves flower powder, we have moringa leaves powder, sorry. So for the moringa leaves powder, we got a significant mean increase of iron intake of 3.2 milligrams after approximately 4 months of use. That means that those two products were successful in improving the iron state of anemia status of women, and also the weight growth of the children. We also perform nutrition education for the children, for the women. So they were trained using recipes, improved recipes of moringa leaves. So we developed 2 recipes from moringa leaves, and that we used for training the women in nutrition. So at a glance, we got that there is an increase of the demand of moringa products. We developed some posters and also some boxes, some training boxes for the women. So let's say that this project was in the co-creation process for promoting moringa. So we got improved level of the women knowledge on the attributes and interest in moringa leaves consumption. There was also an increase of the demand of moringa leaves powder, and also what we get as positive aspect was the awakening of the interest of the communities where the nutrition education were performed. So we get still after 40 moringa projects are finished, we still getting frequent requests for information on the production, on processing, on preparation, and also the recipes. So I mean, this is still continuing. I mean, we are still in touch with the communities to help for promoting moringa for more and better uses of moringa. So this is what I wanted to ask. Thank you, and over.
Thank you so much, Professor Nadia and Professor Coyote. So, we've seen 3 very different but very connected examples from 3 different countries on really why community ownership, community leadership is so key in nutrition, right? We've seen a community coming together in Nicaragua on its own, taking ownership, deciding what needs to be done, creating a loan program, diversification, allowing for diversification of diets. In Malawi, we saw the really integrated aspect of the work, that how, different sectors had to be addressed to tackle this, and how this was done in the community, how the community was part of it. And then we heard from Benny, which is really about how do we use the local wisdom, the local superfoods, the traditional foods, and how can we partner with science, right, with academia, with others to really bring that together, so that it's culturally sensitive, it's nutritionally rich, it's easily available, right? So we've seen these 3 examples. We'll take a couple of questions. We do have a few minutes for questions. So if anybody has questions for the panel, for any of the panelists, please put them here. I see that Dr. Rebecca actually has put in a question. In Nigeria, they have been working with local foods to tackle malnutrition. And they would love to include moringa in it. And she wanted to know if there are recipes that can be shared for them to use. So Professor Nadia, Professor Coyote, is there any place where the recipes are there, or could you, would you be able to share recipes for others to use this?
Because we could put them on our website.
We could also do that. So I don't know what stage the project is at, but I wonder if Professor Nadia or Professor Coyote want to come in and talk about, is that a possibility? Is it shared somewhere? Is it easily available? Or maybe the Bene chapter I know has been working on it from the movement. So maybe Pascal may have an answer to that. Okay.
Yes. Professor Nadia could bring more explanation, but in collaboration with the university and people from the epicenter, that is one aspect I would like really to stress on. And the recipes has been developed in partnership with communities, partners involved in the communities. That is one. And the recipes are available. We have developed process for them, for those recipes, and we could share them right away, but that will be very, that will take time to explain it exhaustively during this call. The documents are available and we could share with those who would be interested to get them. Thank you.
Perfect. Thank you so much, Pastor.
Yeah.
And then Professor.
No, was just, Pascal is right. Sorry, I was getting some trouble with my connection. Yeah, the recipes were developed with interaction of the community with the women. So we have some assistant and also us. We went to the community and then they explained the way they were doing it. And then we have some discussion on how they can improve it. And then in the end, we come up with those 2 recipes. So they are available. We have the process and we have also all the process available to share. Right. Thank you.
Thank you so much. If you have a question for any of the panelists, feel free to raise your hand by using the raise hand button. I think we'll have time for one more question. But I do want to say that I see that there was a few comments from Conte in the chat box, and I was wondering if you want to unmute and share your comments out aloud.
Yeah, thank you. The first comment was about local organization. And just as an example, in Senegal, there's a strong push for decentralization. And there was, all competencies were basically held by the central government, but when decentralizing, they transferred those competencies to the local governments. These are, for instance, youth, health, things like that. But unfortunately, the transfer of competence did not translate into transfer of resources. So local organizations are not only not financially capable, but even just the mere fact of strengthening the capacity of those local organizations is missing. And when you come to the humanitarian or development side, local organizations, like I said, tend to be the subrecipient of the subrecipients of funding. And same here, the capacity strengthening is lacking. Their role is often merely reduced to, implementing activities, which is, for me, the best argument for community-led development, because that's where community-led development will play a key role in asserting the role and the functioning of local government as equal partners, not necessarily just implementers. Those were my main comments. And the other comment I made was when I heard the presentation about moringa, it brought to me the idea that during COVID, suddenly nutrition came to the forefront of the battle against COVID. Now, I'm not supporting any claims here, not being a scientist, but I was glad to see the Benin chapter use also nutrition as a way to prevent or fight COVID. Thank you very much.
Thank you so much for that. I would love to take more questions, but we are running out of time. We want to make sure we do have time for us to get into breakout groups, because I'm sure we have rich examples from all over the world about, how we've been doing this, how communities have been leading in nutrition, some of the successful strategies that you have seen. So that's what we are going to be doing next. We're going to go into breakout groups for 20 minutes. You will get a notification on your screen to join the breakout groups. Each breakout group has a facilitator and a note taker who will, record the discussion for us. And then when we come back, we will ask one person from every group to share just one thing that they heard which stood out for them. We are not looking for summaries. We are just looking for that one thing that stood out for you. We will circulate summaries of discussion and everything after the event, but we won't have time for the report back. So Anna, are we ready with the groups?
We are ready.
All right, so you should all see a notification
Entonces vendrán una notificación.
Sorry, ended interpretation too early.
Welcome back, everybody. Gustavo, I'm glad to see you. I have not forgotten you.
Yeah, it's okay. Well, I left the room. I was by accident. I saw the
Well, now
pop-up.
everybody's coming. Everybody's joining back with you.
Okay.
Were we supposed to be back already, right?
Yes.
Yes.
Okay.
Yes.
I'm gonna.
Now is the time. Now is the time for us to all be back.
And I'm gonna restart interpretation.
Okay.
Wonderful. Thank you, everyone. Welcome back. I'm sorry. I know there wasn't enough time for the discussion. I know in our group, Dr. Sadhu had just started speaking. I'm sure other groups also had that similar situation. If there is a point that you needed to make and could not, the chat box is open. Please use the chat box so that we can capture whatever point that you were going to be making. For now, though, I am going to request each group, one person, to share with us one key thing, something that they heard that stayed with them, that was powerful for them, what they heard, one thing. So let's start with the language groups, actually. And I'm going to request them to actually speak in English, the reporting back. If they can. So who is reporting back from the French group? Is it Michelle? Are you reporting back? Is somebody else?
Marie-France.
Oh, Marie-France. I don't think Marie can report back because she is the interpreter on the channel, so we won't be able to hear her. I'm sorry.
Hang on, we can do this.
Okay, we can do this? Great, thank you, Anna. Anna's the whiz, she'll make it happen. Okay.
Est-ce que je suis en train de parler maintenant? Can you guys hear me?
Yeah, yes. We can hear you and we can hear you in English. So
okay, thank you. So sorry. So in the group exactly what we really discussed, what really impact us, it was the local resources that we need to improve the nutrition. So we really mentioned the moringa example, and we also was talking about the product that's already available, like you guys say, and the forest product in Burkina Faso. So we know exactly that whenever we have the local product, we need to know exactly how to use it. But one of the points that was also important is the obstacle that we have. If we have the product, but we don't know exactly how to integrate it, we're gonna have an issue with the nutrition. Another issue that we really mentioned too is sometimes we don't have a balance between the health, the policy, and the strategy at national level. So we kind of try to kind of summarize everything But really, like we were seeing another example also that was important is like, we are more than happy to receive the help from the example, the ONG group. But whenever they come, if we don't know exactly how to make the impact and the connection with the community, we're still having the issue. And lastly, I know that I'm probably talking too much. We also said that if we have the nutrition, but we also like dealing with hygiene, and we don't know exactly going back to we have to like maintain our strategy, we're still gonna have the issue. That was it, basically. Sorry.
No, that's good. Thank you so much, Anne Marie. And I think Anna is going to enable your interpretation channel again. And as we move to the Spanish group, who is going to be sharing from the Spanish group with us?
I am.
Ibrahim, go ahead.
Yeah. So I heard a few things, but you said only share one, right? But we talked about for the first question, we talked about specific ways communities are creating their nutrition and their food, and so there was examples like in Oaxaca, communities are growing or have started to grow local foods that grow in their areas, so that are more accessible and not as expensive for them, rather than going and getting things from different places that might be more expensive or might be things that they cannot that they don't have as much access to. And then there was another example of in Bolivia, because production only happens really once a year, harvesting that, and it's mostly for potatoes, from what I heard, that they're beginning to use greenhouses now in order to produce more, so that people can grow their own food, so that people have what they need. And then for how civil society and local government can work with local communities, there was the example that in Nicaragua, twice a year, people are allowed to go and air their grievances with municipal government and can raise the issues there of whether like things that are affecting them, and nutrition and lack of food sources might be one of those. And I think that's really beneficial, and that should be something that happens more often in other places as well. Yeah, that's what we talked about.
Thank you so much, Ibrahim. Okay, the English groups, who is going to be sharing a key takeaway from the groups? Did you decide?
I could quickly go first, John.
Sure.
One, we had a really rich discussion, but one thing that I just want to share here is the importance of regenerative agriculture. So that we make sure that we put that we do agriculture that's also good for the soil, so that we can have ongoing and good nutrition in the future. So I'll just share that component.
Thank you so much, Elaine. John, you have your hand up. Are you reporting out for your group?
Yes. On the subject of coordinating with local government, one of the challenges that was brought up was that the chief administrative officers who are required to chair these committees, they keep moving. So we really need strong leadership in these coordination committees by civil society, so that that leadership doesn't leave with the chief administrative officer.
Thanks, John.
Also, I want to steal one second. Gustavo, I promised Gustavo, he has extended the deadline for this new fellowship program. Gustavo, can you make a very quick plug before I hand over the floor?
Yes, thank you. Thank you again, John, for letting me announce the extension of the GATT, IP-GATT initiative. We're looking for 8 community organizers from all around the world who seek to exchange experiences with other activists in order to build broader knowledge about the community-led development action plans, and of course, to carry out advocacy work centered on communities. And the deadline was extended to the 26th of November. And I'm putting here the link where you can see the application. And also, oh sorry, I did that in private. And also the community action guide that guides IP in our community advocacy work for those interested as well. So that's it. And
Thanks so much,
John.
Thanks,
Yes, you're
Gustavo.
welcome.
I know Peter is reporting out for the other group. Peter, right? Would you unmute and share with us one key takeaway from your group?
Okay, I don't know if I can keep it to one. I would say for myself, what I saw was a situation where community groups, they may have capacities, they may even have resources, but maybe they don't know just how to proceed with those. They get kind of stuck trying to figure things out. And one of the solutions that we've seen working very well to resolve those sorts of questions are what they call the village savings and loan associations, which are generally based on women, but they provide both an effective platform and also the managerial capacity to run these types of interventions. They can actually produce nutritious food as an income generating activity, as well as run cereal banks and things like that. So there are quite a few opportunities that communities are still not really grasping that are available to them. And I think that the main, this is my personal comment, the main criteria for that is that these groups need to have a lot of buy-in, and that requires a lot of solidarity. It's group solidarity. People know each other and trust each other. And with that foundation, you can go a long way with these groups. Thank you.
Thank you so much, Peter. I know our group, we didn't actually appoint somebody to report back, and in the interest of time, I'm just quickly going to say that we talked a lot about coordination between different ministries and governments, about integration, and about local foods and recipes, but being culturally sensitive, and also making sure that the local recipes or the superfoods are palatable, tasty, and acceptable to people. So John, if you can get the slide deck up, I want you quickly, I know we are at the hour, we're actually a minute over, we are going to be probably, and people will have to drop out. I just wanted to very quickly share where are we going from here. So everybody came here, you shared your time, your experiences with us, what happens next? This was, as Roland's mentioned, an official side event for the N4G Summit, which means that we report back to the summit on what happened here. So the discussions, whatever happened in the breakout groups, what we heard from the speakers, what you have put in chat. I'm sorry we haven't had the time to bring out everything that was in chat, but we are definitely following and recording them. All of that is going to be put into the report and sent back to the N4G Summit people to see why community ownership is so important. We are also going to be doing a position paper on community ownership and leadership as a key to good nutrition. John's going to be working on it. If anybody has inputs, comments, materials, examples to share, please reach out to John. John's, I didn't even check with you on this, but I'm already putting it out there. Apologies for that. But please reach out if you have experiences, examples to share, to be included in the position paper or would like to collaborate on it. And finally, in January, we are in partnership with the Right to Grow movement initiative. We are planning an event which is really not going to be about any specific thematic area. We've had 3 big UN events this year. Well, 2 and the third coming up. We've had the UN Food System Summit. We've had the COP26, and now we have the Nutrition for Growth event coming up. With the Food System Summit, there was a very stated intent of making it inclusive and participatory. And I know we all had very different experiences with it, and we will, in terms of how it wasn't or was. COP26, I know a lot of us have had different experiences with it and how civil society really did not get a voice there. And now we have Nutrition for Growth coming up. The event in January is really about seeing what can be done to make the UN processes more participatory and truly inclusive. And we are hoping to have government representation in there who can hear this and carry this back to the agencies that organize these summits. Next slide, please. Finally, We have 3 events. I know you see 4 on the slide, but one of them is actually not going to be happening. Before the end of the year, we do have 3 big events happening. One is that on next Monday, which is on 29th of November, we are going to have the next in our sector dialogue series. So we have the dialogue on community-led adaptation for climate change. We have a wonderful lineup of speakers and facilitators because this is an issue that, you know, impacts all of us. So that's on the 29th of November. We will not have the COVID call on the 1st of December. We are actually going to have it in January. And the COVID call is actually going to be a workshop on community-led MEL for January. So a lot of people had asked for how is it possible to do community-led MEL? What are the resources? What can be done? What is being done? We've put together a workshop for that, but you know, on popular request, we've moved it to the new year so that it's not clouding people's calendars now. On the 6th of December, we have All Democracy is Local. This is a side event to the Summit for Democracy, the Biden Summit for Democracy that is taking place. And then on the 15th of December, we will have the movement's monthly call where we're really going to look at the strategies for our national chapters for 2022. John, I don't know if there's anything you want to talk about the democracy call.
No, just it's like this event. This is a official side event. We intend to bring the issue of local participatory democracy to the summit. And so it's advertised on the Summit for, the number 4, summitfordemocracy.org website. So we hope that lots of people can attend. We really want to ensure that world leaders know that decentralization, capacity development, the empowerment of all women, youth, and marginalized groups, and all of our goals are important to strengthening and deepening democracy.
Thank you, John. And thank you everyone for being in the call, for staying the few extra minutes. We always try to make sure we don't go over. We always go over, but you all bring such rich content, examples, experiences that it's very difficult to finish on time. I know there's a lot coming up on chat. We will put in everything that's there and include it. We will go through it. Thank you, everyone. Thank you to our speakers. Thank you for bringing us the field experiences, the lived experiences, your own and of others. And thank you for sharing with us some of the best practices, successful strategies that you have seen. And I know there is a lot of excitement about seeing the moringa recipes. So we will actually include the resource that Pascal and the Benny chapter of MCLD mentioned in the report out for everyone, because I heard India is using it. I've heard a lot of other countries use it. So we will share it out. Thank you again, everybody. And in true movement fashion, feel free to unmute and say bye. And we'll hang on for a few minutes to just say bye. And if anybody has anything very pressing that they want to say. But thank you.
Bye. Bye.
Bye-bye.
Thanks, everybody. Bye.
Bye.
Bye-bye.
Bye, everybody.
Bye-bye.
Thanks, everyone.
Bye.
Thank you.
Take care.
Thank you.
Bye-bye.
Everyone. Bye-bye. And thank you to
Bye.
interpreters and translators for making this so
Well done.
Gunjan, it's Pat.
Next.
Gunjan,
Yeah.
it's Pat.
Hi, Pat.
Hey, I sent John a text at the very end. The Church of the Brethren, which I belong to, and we do work around the world, but we actually have a seat in the UN. We've had it for 50 years, I think. So do you know of other
That's great.
churches, NGOs that have seats at the UN?
No, but we can try and find out from our members.
Well, I'm a big believer in having, those connections through people that are there. And this member who represents the Church of the Brethren at the UN, she lives in Brooklyn.
Okay.
So she can go directly to meetings there. And I just think those are the kinds of opportunities that we ought to, be trying to take advantage of to communicate, because, the effort to get people aware of some of these needs and opportunities is pretty daunting.
Perfect. Pat, we'll be in touch and let's carry this conversation onwards and see what.
Okay. Thanks.
Thank you for bringing it up. And thank you, everyone. Bye. Bye, everyone.
Bye.
Bye.
Bye.